Hi, everyone. I'm David Greenwald, the founder and director of the Davis Vanguard, and I want to thank everybody for coming out. I was going to say this evening, but it's actually this afternoon on a lovely day where we're probably going to see rain at some point here in Davis, which is appropriate considering our topic is homelessness in Davis. I am going to turn over the moderation of this event to Lauren Smith and Jordan Varney, both are co-editors of our Davis City Desk for our student publication, The Vanguard at UC Davis. Just to let everyone know, if you have questions that you would like the panelists to answer, what you need to do is post your question into the chat, and then as they're going through and asking questions, the moderators may or may not incorporate those questions into the broader discussion. So at this point, and just to let people know, in 11 days on the 22nd of February, also at noon, we will have our next webinar, which will feature the Yolo County Public Defender's
Can you hear me okay now? This is a different computer.
Yeah. All right, so I'm going to turn it over to Lauren and Jordan.
Hello, everyone, and welcome to the Vanguard webinar series, where we focus on culture and politics around Davis. I am one of your hosts, Lauren Smith, and with me is my co-host and co-editor, Jordan Varney. And as David said, we are the student editors of the Vanguard's City News Desk. We are lucky to be joined today by 4 guests who are doing influential and important work in Davis. Would you all like to introduce yourself and talk briefly about what organization or group you represent? We can go Ryan, Rebecca, and then the folks from Hope.
Sure. Good afternoon. Thanks for having me. My name is Ryan Collins. I am the Homeless Outreach Services Coordinator for the City of Davis. So I am an unsworn officer at Davis PD, but I am not a cop. I'm a social worker embedded there, and I provide direct services to people experiencing homelessness, as well as try to work on improving the system sort of more broadly that we use to serve people living in homelessness, and hopefully to improve the outcomes for them as we try to help them out of bad situations.
It looks like we lost Rebecca, but hopefully she'll come back. So if Selina and Seanne want to go.
Hi, I'm Selina. I use she, her pronouns. I'm the publicity chair for Hope at Davis. And to give a little bit of an introduction about Hope, Hope stands for Homeless Outreach Through Prevention and Education. And we're an undergraduate student-run advocacy organization at UC Davis that focuses on providing resources and knowledge to improve unhoused people's self-determined quality of life. And Seanne can add some more about that.
So yeah, hi again. My name is Seanne. I am a third-year UC Davis student, and I'm one of the general members of Hope under the City Policy Interest Group, which Selina leads. Yeah, I know someone asked, when like Hope was started and things like that. Yeah, we started in 2009, but we didn't become a fully UC Davis affiliated org until like 2016, I believe. But yeah, a lot of things have changed since like its founding, but our mission still stays the same. We really try to outreach to, under-resourced populations or under-resourced community members. And normal, circumstances like, since the pandemic, we usually take part in street outreach, and we collaborate with different organizations such as the Opportunity House, Empower YOLO, which basically serves to provide resources and any kind of assistance to people in need of like housing or other things like that. And we usually host, quarterly events such as Fresh Cuts and Fresh Starts. If you haven't heard of that, just a quick overview is basically we provide like haircuts and other, services like that to people in like downtown Davis. And we also have panels and film screenings, and we host a benefit concert too, in which we raise funds. But in light of the pandemic, we're mainly focusing on outreach and making sure people can get access or turn to the resources that might help them at this time, because yeah, this is a really uncertain time. So, you know, street outreach and giving out refreshments, toiletries and things to stay warm is like all the more important. And yeah, and these are activities that every member in Hope participates in, including, so like me, but like I mentioned before, there are interest groups like city policy, student resources, mental health, community education. So we really try to delegate, you know, those different tasks and different focuses in order to, I guess, broaden Hope's reach to the community and try to touch as many bases as we can. Yeah.
Awesome, thank you. And then Rebecca, do you want to quickly introduce yourself?
Hi, I'm Rebecca Trujillo. I am the supervisor for Respite, which is day services for the homeless population in Davis. We work here at 530 L Street and we are open Monday through Saturday. We have day services again, just laundry, well, different things, laundry included, and also showers, case management, linkage to clients' doctors, mental health as well. So there's different things that we do here.
Awesome. Thank you everyone for coming. So today we will be discussing homeless outreach services in Davis. As we all know, homelessness is a really big issue in California and in our community as well. As of January 2020, 151,278 people were unhoused in California. And in 2019, Davis had 190 unhoused folks. The number of unhoused youth in 2019 in Yolo County was 86, and all of these are pretty staggering numbers. So right now we are going to move on to the questions that Jordan and I have prepared for our panelists. So the first question is more general. What sort of programs and services currently exist in Davis to support the unhoused population? And anyone can answer.
I guess I will take a first crack at that and hope that the other panelists can fill in anything that I missed. But there are programs and services offered in Davis by units of local government, by nonprofit organizations, by student groups, by church groups. And many of them participate broadly in the countywide continuum of care on homelessness, the Homeless Poverty and Action Coalition, which I'm the chair of. And what someone experiencing homelessness has in terms of the details of their life is going to vary greatly. So the beginning of someone getting some assistance is to really understand in detail their unique situation, and then to try to pair them with appropriate resources. So those kinds of interventions generally take the form of first providing for someone's basic needs. Think food, water, shelter, physical safety, emotional safety, getting someone into an environment that allows them to work on any longer term challenges that they might have or barriers to attaining permanent housing. We don't have a dedicated year-round emergency shelter in Davis. Right now, we do have, because of pandemic response, actually some emergency shelter that's more accessible to a larger number of people than we would otherwise. So a lot of that is through a program, statewide initiative called Project Roomkey, which is getting people that are medically vulnerable to COVID-19 based on this CDC list of criteria of conditions that increase your chance of mortality from it inside, and given wraparound supportive services, case management, food, in individual non-congregate settings. So we're using some local hotels for that. Currently, we have 70 people sheltered through that program. Although that's high, it's sort of a peak. We had to use some surge capacity because there was a recent COVID-19 outbreak at the Fourth and Hope Congregate Shelter in Woodland. So we have an extra 30 people that are in isolation or quarantine at one of those sites. In addition to that, the organization formerly known as the IRWS, the Interfaith Rotating Winter Shelter, which used to have a model of providing congregate shelter each winter in a weekly rotating site of like churches, that they have adapted to COVID, and they have a program called DESP, the Davis Emergency Shelter Program, which is again providing non-congregate shelter to that medically vulnerable population. A lot of people might start in a hotel room through Project Roomkey and then get into an apartment, which is really a better and more home-like setting for a longer term placement where they can continue working on whatever it's sort of necessary for their case. And they have, I think, a maximum of 40 people and about 38 served right now. There's a brief turnover when someone exits to something like permanent housing, and then they need to clean it, or maybe there's a new person entering. They do have the capacity to quarantine people, but that's generally more served by Project Roomkey. And then also there's Davis Community Meals and Housing, which has a transitional housing program for single adults, I think in families as well. I know the single adults is something like 12 beds. I don't know how many families are currently served, families with minor children right now. There's Empower YOLO, which runs a secret location and safe site for survivors of sexual assault, domestic violence, stalking, trafficking. I'd have to check with Lynette, but I think that they did do some renovating recently, so it's close to 40 beds. Maybe Selina or Seanne might know better about that. And then there are also families that are placed from county CalWorks in individual hotel rooms while they're working on getting them permanent housing through the CalWorks Supportive Housing Program. So when you add all that up, it's pretty close to that 2019 census number that you said of 190 people, which included both the sheltered and unsheltered population counted in Davis at that point of time of January 26, 2019. We have almost that many people just sheltered, in addition to people that are living in unsheltered circumstances in places not meant for habitation, or maybe couch surfing, staying in a car, a garage, a ditch, just wherever they can find a safe place to be. In terms of once a person is sheltered, and the best practice, housing first, is just to get somebody inside as quickly as you can with as few barriers as you can. So you shouldn't be saying you have to be clean and sober, you have to be this tall to ride, that kind of thing. It's recognizing that the lack of housing is an unmet fundamental need and an emergency, and you should just take care of it ASAP. There are programs run through agencies like Empower YOLO or Stake that provide rapid rehousing dollars, which is mostly geared for people that are kind of assessed as being of medium vulnerability, just to provide them with some short-term financial assistance to get them back into housing. If someone is imminently homeless, there are some limited funds for homelessness prevention, where if you have an eviction notice, they might be able to help you with rents in arrears to prevent your literal homelessness on the street. There's also permanent supportive housing, again, run by organizations like Davis Community Meals and Housing. They just opened Creekside recently, as well as organizations like the YOLO Community Care Continuum. Permanent supportive housing is kind of jargony, but it's a pretty simple concept, which is permanent housing that has supportive services looped into it. So that might be an on-site social worker or on-site medical care that meets the needs of people that have more complicated cases, often coming out of chronic homelessness with a host of comorbid conditions. And then there's street outreach, which is often the first step of all this in identifying people and getting them linked with the appropriate resources. That's what I and my team do, as well as lots of other organizations. I think Hope does some of that. But you want to be able to make a human connection with someone where maybe their faith in the system is rightfully eroded. And they might not know what options there are in terms of assistance from the broader community to help improve their conditions. Okay, and there's Respite Center, which I want Rebecca to talk about.
Hello. So the services that we offer here, well, the staff is actually Communicare. And so we have myself, who's a clinician. We have 2 case managers, and we have a safety ambassador as well. We also have people that come in from Communicare on the weekends to sub in. So we have that going on Monday through Saturday. Again, we do link a lot of our clients to, it could be a Communicare doctor. They don't necessarily always have to be a Communicare patient. Dr. Kim has made his rounds here. Ryan knows him. He goes to Project Roomkey as well. We also have nurses that come from CommuniCare, and they'll come over here and see clients, like answer any questions. It's easy for the clients to see them, and then the nurses are able to link them with any doctor that is available, or maybe Dr. Kim, and also they can ask the doctor's questions for the client. So it's pretty convenient. Let's see here. We do offer, so we have somebody who comes by. Her name is Evelyn. Ryan knows her. She helps people link with SSI. So she'll take on certain cases depending on the situation. So we have that too. We have a new program that is run by some vets at UC Davis. It's called Pause, and it's basically free care to the homeless population, to their pets. So they do that the first Saturday of every month. And as you know, that could be, very costly for someone. So these services are free. These are free for them. We also have we do have people that come here, social workers from other programs, to link in with their clients, because it's hard to find them, out and about. But if the client can call them from here, they can come meet them here. So we're doing that as well. So those are some of the things that we offer here at Respite. We also have a storage area where people can hold their belongings here while they go to appointments. It's really hard for them to carry all their belongings around, so they can bring them here to Respite, and we can keep them here in a safe place for them, which is a good thing. Those are some of the things that we offer here. So yeah, that's
Awesome. I am gonna jump in because our next questions are about the Respite Center. So more follow-up questions. So it's a great addition to the Davis community. And what were we doing like prior to this program? And it's a pilot program. So what is the long-term plan for it?
So for right now, we know that Respite will be funded until probably January or February of next year. After that, I'm not really sure what's going to happen. I mean, I think that the city of Davis has really taken a step forward to just really help the situation. And this is part of their, corp yard. So they have everything set up for us here. This is the city of Davis. It's the property of city of Davis. So as far as, I'm hoping that in the future that we do get refunded, I'm not sure. I think that the homeless population should have a place where they can go and charge up their phones, use Wi-Fi, use a computer, wash their clothes, take a shower. All of those things are here at Respite, and we provide like everything that they need as far as like shampoo and towels and all of that. So I'm hoping that we do get refunded. I'm not sure yet. I know it's a pilot program, so that's, part of being a pilot program. You never know.
Rebecca, would you mind if I answered the first portion of the question, which was what was here in Davis before?
Yeah, absolutely.
Okay. In addition to Respite Center, there is a day services resource center at 1111 H Street, operated by Davis Community Meals and Housing. I think historically they've run pretty close to capacity, and we're still seeing people attend both sites. So it speaks to the dramatic need that there is. That day shelter program, I think, has more limited hours. So it's something like 8 to 12:30, Monday through Friday. Respite centers open several hours longer than that, and an additional day a week. And Respite also has people like Rebecca, on-site clinician, and more of a linkage with CommuniCare and their healthcare providers. So I think maybe it serves just a slightly more high needs population on the whole, but there's a lot of overlap. And there are some people that would go to 1111 H Street in the morning and then maybe come to Respite in the afternoon. There's a bit of overlap. And then before Respite, maybe people would just use other public facilities that were open as a way to get by. They might go to the Yolo County Library and hang out there during the day and at least have access to, a restroom and some heat and some internet. But Respite has really spoken to the direct needs and created a dedicated place.
Yeah, it seems like a great help to the community. So it's a daytime facility. So right now, what do unhoused folks do at night when they need something? And does the city have a plan in the future for providing 24-hour service?
So for us here, the only thing that we've been able to provide them, which has has been a great help for them is we've been able to provide them some tents. We can give them sleeping bags, blankets, thermals, weather socks that will keep them a little bit more warm, hand warmers, tarps, just some things that can at least ease some of the cold for them. That's the only thing that we can offer them here, unfortunately. So, yeah.
To the question of does the city have plans for 24-hour service of some kind? And where do people go to get their needs met at night? I think that some of the shelter programs like Project Room Key or Desk, there's no like 5:00 p.m. entry and then you're kicked out during the day. It is 24 hours that you can stay there. But staff supportive services are generally available more on people's 40-hour-a-week style work schedules. So more during business hours. And after hours, if somebody needs assistance, sometimes it's not as available. There are crisis lines that you can call, but if you need to get an in-person response 24/7 at 2 a.m, sometimes that gets kind of by default kicked to a higher level of care, like the hospital that then might contact respite center or me in the morning to try to get a more long-term placement.
Gotcha. Okay, that makes sense. Then that there's a good helpful daytime thing, and then maybe the nighttime help is something that might be forthcoming. So in terms of that, what are some improvements that you might like to see at the Respite Center or other services that you would like added?
So maybe an additional day, like a Sunday would be great. And I also want to add that we do referrals to the Fourth and Hope shelter. So that is something we've done quite a few of, not right now, but we will in the future. They've opened a new shelter that they can accommodate more people. So, so that's nice. I'm hoping that the respite can continue on and that we have more clinicians that can come in here and help clients with the mental health part, as well as any therapy that they would like to do. A lot of the clinicians at CommuniCare have different types of counseling that they're able to do, including EMDR, which is a really great one. So I'm hoping that that is something that can happen in the future for respite.
I think Rebecca's got a really good response there in terms of, I would love to see respite continue and expand in some form. I love the idea of 7-day-a-week service. I love the idea of more clinicians being involved, whether those are mental health clinicians or more people like Dr. Kim, where he and his team do street and shelter medicine. So they will meet a client at the respite center, or they will meet a client at the hotel for non-congregate shelter, or they will meet a client at a camp. And depending on what barriers to access somebody is experiencing, they might not be able to go to a specific doorway at a given time in order to seek assistance. You might need to bring it to them. And I would love to see more kind of last mile delivery of services as is needed, especially for people that are very kind of disconnected from broader systems of support. Beyond that, of what else would I like to see in our continuum? The city's put in for a grant for a pilot program for a sanctioned campsite. I mentioned earlier that we have some COVID relief funding that's allowed us to target non-congregate shelter for medically vulnerable people when it's on the CDC list of guidelines of conditions that qualify. So I think Rebecca's had the experience of emailing me and said, hey, possible Project Room Key shelter client. And we go through their case and you look at the eligibility criteria and then you look at what they have. They may in fact have a medically complicated set of conditions that render them more of a vulnerable person in general, but it doesn't fall on this list of guidelines that ultimately accounts for reimbursement dollars that the county will be able to get in order to shelter people. So there are folks with things like multiple sclerosis that are living outside where it can be very debilitating, but they're not given a non-congregate shelter opportunity, or people with severe psychiatric conditions. There was some good research from Yale last September that showed that people with psychiatric conditions can have greater mortality from COVID. But if you have schizophrenia, that's not considered one of these conditions that makes you more vulnerable to COVID in the eyes of the CDC. So what it's created is kind of this landscape of gaps in terms of equal opportunity for a high level of service. And I would love to see our community set kind of a minimum standard that someone can receive. A sanctioned campground where you had purpose-built structures, like kind of like tiny homes, better than tough sheds, heating, electricity, AC, bathrooms, showers, some security, some peace of mind, and being able to stay there versus having to kind of go it alone, like guerrilla camping in a tent, wondering if you and everything you care about will be safe or not. I don't think that that meets a minimum standard. So I'd love to see us raise the bar.
Those all sound like very good goals and improvements for the unhoused folks in Davis. We had a couple relevant audience questions. So was there a homeless survey in January of 2020 for Yolo County and Davis? Is it a yearly thing?
If you're talking about the homeless point in time count census,
Yeah.
that's mandated by the federal government for it to be an unsheltered count every odd numbered year and a sheltered count every year. So there was a sheltered count in 2020, but it doesn't speak to what most people think of when they think of homelessness, which is people, again, living in conditions not meant for human habitation. There was going to be a January 2021 count, but Yolo County asked for an exemption from that, as did 37 out of 44 or whatever it is, California counties, and then the remaining ones asked for partial exemptions. And that's really just because of the pandemic. In terms of exposure to risk for clients that we'd like to serve, as well as staff and volunteers, it's been a challenging year to do that. So what we don't have is recent data in terms of the actual numbers. I would like to see that data refreshed not only annually with both the sheltered and unsheltered count, but really in much higher resolution than that, like an ongoing kind of maybe not a census, but some way of getting a clear idea of on a given night at any time of year, not just these once every 730-day snapshots of how many people are living outside. And I think that most people recognize that the official pit count is always an undercount. We showed 190 people, but that's 190 people that we were able to locate and talk with and who agreed to do a survey, or that there was a visual count where it's like, okay, that person is asleep in a tent, and we know them from providing services that they are experiencing homelessness. But there's also kind of an invisible side of the epidemic of homelessness for people that might be very unstably housed, doubled up, hopping from couch to couch, just not wanting to approach service providers for whatever reasons. And I think like talking with Howard Chanel, a colleague at the Aggie Compass Center Basic Needs Center, that he knows of at least 30 sites on UC Davis campus where people can be found on a given night, living in homelessness. So we need to do better and really kind of improve our systems of data collection beyond whatever is just required by the federal government as a precondition for funding, and more towards having a better answer of the question and a grip on the scope of the problem.
Thank you. So if people wanted to find the 2020 shelter report, is on the city's website?
I can check for you. I would search for, it's probably on the Yolo County website. The Health and Human Services Agency manages a website for HVAC that should have that shelter report on there. Yeah.
Okay.
And an off time when I am not like monopolizing so much airtime, I'll try to find it in the background for you.
Okay, great. Thank you. And for the Respite Center, what is the funding source? Do any of you know, like grants, city general fund, a mix of both?
I think it is a mix of both. The city of Davis has really been helpful as far as like getting the things that we need here at Respite to also succeed in helping the homeless population. But yes, it's a mix of both.
Okay.
Okay, great. We have touched on a little bit about Project Room Key. Could you talk a little bit more about where improvements in the program could be made? Perhaps an increase in services offered, maybe more outreach?
I can just give my part of it. We've done quite a few referrals to Project Room Key. Sometimes people have to be asked to leave if they're being inappropriate. So I think that with that being said, if the client is open to maybe working on some of those behaviors, maybe they can be given a second chance depending. I don't know, it's kind of tricky. I know that they have to keep the other clients there safe as well. So I think that's some of it, it's pretty complex. There's just different reasons why people will be asked to leave Project Room Key. Definitely so many different reasons, but maybe they can get some more help. And then if they choose to, and the team is willing to put them back in, which I've seen happen. I have seen that happen.
Yeah, I think Rebecca touches on Project Room Key is a statewide initiative, and it was done in a pretty quick scramble where we needed to create a lot of non-congregate shelter options that previously didn't exist. So, I mean, ultimately, it's a public-private partnership between government and hotel proprietors who have depressed revenues during the pandemic that said, hey, yeah, we'll lease you, big blocks of rooms in order to do this, but people still need to abide by hotel rules, or they might have pre-existing ban from a hotel because they had a bad day at some previous interval. And that means that they're not really able to avail themselves of Project Room Key if they run afoul of a private proprietor's decision about whether or not they should be there. I'm not saying that emergency shelters run by nonprofit organizations never ban people. They do, but generally there's kind of an easier path to earn your way back or be able to resolve a conflict and then access that emergency shelter again. So it's one of the challenges of this kind of patchwork solution where, again, we're doing the best that we can with the resources available to serve a subset of the population. But maybe there would be some way to find additional options that are more cost effective and maybe allow clients to have things like bad days and not have that end up terminating a really sort of basic need.
Selina, you put something in the chat that was relevant. Do you want to share it?
Oh, just to add on to what Ryan and Rebecca have already said about like existing resources, there was one person who asked in the chat if there are any unmet needs or gaps in the resources that are provided currently. And Hope has done a little bit of like gathering feedback while we conduct street outreach every other week. And one piece of feedback we've received is that there seems to be a need for like an easy way to transport personal belongings because some people who live outside will move from place to place. And someone has mentioned that they wish they were able to legally own a shopping cart. Yeah, so that's basically what I wanted to add.
Great. That definitely seems helpful and a relevant resource. Okay, so moving on from Project Room Key, how do you plan or how have you so far worked to mitigate the spread of COVID-19 amongst the unhoused population in town?
Well, I can tell you what we're doing here at Respite is they come in and we screen everybody. We ask them if they've had any of the COVID symptoms. We also take their temperature, they're given a mask, and they're also given a shield. So everybody at Respite has to wear both, the mask and the shield. They can prop up their shield if they're eating. They also have to social distance. So we've had to take some of the chairs out of our main hub building, which is unfortunate, but it's what we have to do. We also have a resting area, so we've had to take cots out of there as well. Just trying to social distance. So I feel like we've been really good about just keeping everything sanitized. We do that as well. We sanitize all the time. So, we've been fortunate to I feel like not have had any outbreaks, and you know, none of the staff here as well. We've been, fortunate that no one has gotten sick. So that's what we're doing as far as here at Respite.
At Project Roomkey, something that's been a recent push since they've become available is vaccination for any Project Roomkey or other non-congregate shelter programs like DESP for any clients that are interested. So it's voluntary, but a tremendous number of people have taken the county and service providers up on that offer to receive, I think it's the Moderna COVID-19 vaccine on site. So that's one way that hopefully will long-term protect them from COVID. Beyond that, it's providing individual accommodations so that people aren't in a shared airspace where they could easily contract it from somebody else, even if it's asymptomatic, and providing them with on-site access to medical care so that there's good diagnosis and kind of early detection of symptoms and appropriate placement so that we have our population of people who are at risk because of like chronic health conditions at one site and the population of people in isolation or quarantine at a different site so that we're not exposing people who are highly at risk to those where they've contracted it or been exposed.
Yeah, it's helpful to hear that there are more sites popping up that people can go to because I feel like the loss of the interfaith rotating shelter this winter was really felt because that was a place where many people could go sleep, and now that everyone has to be separate, it's nice to hear that there's places for like symptomatic and asymptomatic people to go. Now we're going to move in to talk about sanctioned camping. So you've talked a little bit about this, but how do you all feel like sanctioned camping impacts the unhoused population? What are some of the pros and cons? Because I've heard from some people that there's a worry that if we have sanctioned camping sites, then other people will be encouraged to move from where they currently live in Davis, and that some people will not want to move. So talking about that would be great.
Okay,
Well,
so
first, Ryan.
good. No, you can go ahead. I've talked a lot.
Sorry, the mute button. Well, this is kind of your specialty, Ryan. I think you have a lot more information, but as far as I can give you just the view of what the clients have said to me is like, it's frustrating. They don't have anywhere to go, or they're asked to move when, they have a campsite. So it's really frustrating for them because they come in here and they're pretty angry. And from what I see, like they do definitely need a spot where they can like throw away their garbage. That's a big thing. But those are just the things that I hear as well here at Respite. But I know that Ryan, you have a lot more hands-on information.
Sure. So there are kind of a few questions nested in there at once, but it's sort of like, what do we hope for from sanctioned camping? Why is it an important step to take, and how will that impact the experience of clients? The need for sanctioned camping only exists because we do not have enough emergency shelter or permanent housing places to give everybody a spot to stay at night who wants one or who needs one. There simply aren't the beds kind of as available inventory. I think that if we had that, then we wouldn't have need for a campground. But this ties back to kind of the epidemic of unsheltered homelessness nationwide. California is the center of that. We have 1/8 of the nation's population, but literally half of its people living in unsheltered homelessness. And the source of this is really economic, where California has had for a long time very high housing prices, and for many decades focused on the development of things like luxury units over the development of things like affordable and very, very affordable housing with subsidies. So you couple that with things like deinstitutionalization that may have offered people a long-term placement in something like a hospital or other long-term supportive care environment where they're left to fend for themselves, and people can't afford a place to live. They may have what is seen by landlords as some kind of a mark on their record that makes them an unwelcome tenant. And because we have structured our society in a way that housing, even though it is a basic human need and human right, is kind of adjudicated by a private capitalist market, it creates winners and losers. And the sort of foremost examples of the stretching rubber band of inequality are people that can't have a safe place to live. So when you're living outside, I see it as someone kind of taking their lives into their own hands, because in some ways, systemically, we have failed them by not ensuring that that most basic fundamental need of safe shelter and housing is met. When you're camping, frequently it might be illegal against a sort of local code ordinance. There was a court decision from the Ninth Circuit, Miller v. Boise, that said if a person is camping outside and they're otherwise not, engaged in any kind of destructive, behavior, criminal stuff, harassment, creating a public health hazard, anything like that, and you don't have a safe place for that person to go, whether it's an emergency shelter or a housing bed, that it's kind of cruel and unusual punishment. It's a violation of their Eighth Amendment rights. In order to say you have to get out of here, move along, it's a very reasonable question for someone to say, but where would you like me to go? So and also the experience of camping is often fundamentally unsafe. You don't have a door that closes and latches. You have no guarantee that your belongings or your person or your loved ones or your pets will be there in the morning. It can be traumatic, just in kind of like a microcosmic level, just to have people see you and automatically judge you. And it's not a way that allows someone to be in a constructive frame of mind or in a therapeutic environment that they can get back on their feet. I guess I'd point out that for the great vast majority of human history, like 99.99% of a couple 100,000 years that we've existed, it's been an acceptable behavior to carve out your own place in the world, to erect some kind of structure that meets that basic need. But as we've grown, civilization, we've created rules of structure and power that say, okay, but that's against code. You can't do that here. This property is owned by a person, and even if you aren't bothering somebody, we deem it communally as being against the law, even though you're trying to sort of exercise your claim for what's a fundamental right. So I look at something like a sanctioned campground and say, this is something better. It's not really what's ultimately needed, which is safe housing for everybody, but it is a start towards a place that is purpose-built to meet those basic needs, under which you won't go through any kind of harassment or persecution. You can feel safe. You can know that your stuff will be there the next day, and maybe you can get a start on, helping to dig yourself out with the help of the community from where you are. And if a person is camping in a way that actually is harmful to the community, like camping along a drainage canal where they don't have access to sanitation, so then they're defecating into the city water supply. This is a thing that's happened. That creates kind of prevailing need for health and safety for the person to move. And I would love to be able to say, I'm sorry, you can't camp here, but we do have a place that is far better that we would be able to help you get into. Otherwise, for someone that's camping and minding their own business, if they didn't want to leave, but they weren't engaged in any kind of destructive or criminal activity, and they're not creating a hazard to others, I take a mindset of live and let live, and that's generally the policy of the city as well.
Okay, that is helpful to know. We had an audience question that is related. So has the city designated a location for the proposed sanctioned camping site, and what services might be provided there once it comes online?
I know that we've done the research for a site, and that has gone through some stages of environmental review. I don't know how fully along that process is. And if that first one doesn't work, then they would look at other city-owned property around the city, but we don't have a final location. And in terms of what services, I think the plan would be to offer some on-site supportive services by partnering with the RWS rebranded to Heart of Davis, I think, but that organization that's currently running the non-congregate shelter desk for providing some on-site supportive services and case management, and then just basics of hygiene and electricity and heat. Think about what you can get at a campground, a safe place to go pee, a safe place that's yours, this is your spot, and something like a little stronger than a tent cabin, with a door that locks. and as well as transportation to sites like the Respite Center that maybe offer fuller service.
Okay, great. One last question before we move on to addressing the rest of the audience questions. What is your vision of the future for addressing homelessness in Davis, both short-term and long-term? And how can community members be involved to help support the unhoused community and other services that we offer for them in Davis?
I can jump in real quick about this topic. So I think right now, the city of Davis is doing a great job at approaching homelessness from like a public health, public safety, or just like trying to have a holistic view of how we can best serve everyone's needs while not like being too intrusive about people's way of life. So I think right now that's really great. And that's an approach that should continue into the future. And kind of also relating to the last topic, Hope is also really supportive of the idea of sanctioned camping because sometimes people like out of necessity will end up staying in areas that are not the safest for them. And if there's a place that can provide safe shelter and resources and case management to them, that would be a better option and be safer for people who are living outside. And in terms of how people can contribute and kind of help people who are in need in Davis, Hope does accept donations, and that would fund some of our programs like street outreach, where we provide refreshments and resources, as well as like warm clothing, things like that to people living outside. Our showers program, which typically runs when the pandemic is not happening. So we have a showers program at Hickey Gym on campus, where we essentially provide free showers to anyone who needs it, and our quarterly events. So that's where funds would go. And of course, there are also plenty of other organizations in Davis that would be happy to accept your donations and help.
I think that's a great response. I agree with everything there. I think that you can support the effort with time, money, donations, and advocacy. So you can try to appeal to local government boards like the City Council or the Board of Supervisors for the kinds of solutions that will really benefit people experiencing homelessness and the community at large. You can give money towards efforts that are helping to directly serve people living in homelessness. I've been part of a work group that's been working slowly on like a community health navigator program that might train volunteers in order to provide some direct services like some outreach to people living in homelessness. I think it should be a goal to minimize the amount of time that somebody is spending outside. I think that every single night that somebody spends outside is kind of an iterative opportunity for something to go wrong, and that you look at someone who spent one night on the street and it's might be the worst night of their life, but it hasn't really taken the tremendous toll on them that maybe years on the street will do in terms of the sort of overall loss of function and of hope for something better to occur. So we should really try to stamp out chronic homelessness and serve the people that are most vulnerable. And we should try to, as quickly as possible, be responsive for people's needs in the community when they are experiencing homelessness at the outset. That's when it takes a smaller amount of resources, whether we're talking about a lower amount of dollars for rapidly rehousing someone versus the long-term ongoing costs of permanent supportive housing. The difference is how quickly did you help that person in need? And I would like to see the opportunity for the community at large, for anybody who's interested in being a helper, to have that opportunity to serve. Like the people that have been living in chronic homelessness, sometimes literally everything has gone wrong in their life, and you need kind of the expensive time of dedicated professionals. You need medical doctors, you need licensed clinical social workers, but sometimes you actually need far, far less than that. Sometimes you just need a person that's willing to listen, or someone that's willing to extend a hand and help, and that could be a volunteer that's gone through a month of training. There is a continuum of needs, and I think that we need to be right-sizing our interventions just at that right level. no more than no less, such that maybe even a volunteer can meet someone for the first time where there's some kind of alert that says, hey, please go talk to this person in need. They might discover that it's above their pay grade, but there should be kind of an easy path for advancement and escalation towards that right need until the person has assistance in getting them into the right kind of course of therapeutic treatment or assistance financially, or a better sort of setting that's needed case by case to get them back on their feet. And we should go help the next person.
I definitely think that there should be some type of housing for people that have had previous evictions. That is a huge problem. I mean, some of the evictions can be like so long ago, but they have no chance of getting into any type of traditional housing. So if there was a program that would be like a second chance, I mean, that would help immensely for a lot of the clients out here. And of course, I mean, I've known clients that have an income, they just have had an eviction that happened like 15 years ago and they can't get any housing anywhere. When I worked at YCCC, when we would house someone, we would make weekly just stop in, sit down and talk to the client, what's working, what's not working. Sometimes we would take them shopping. It was just like even teaching them the smallest things, on how to stay housed, how to resolve any conflicts with your roommates. So I think like just our clientele would also, not all of them, but some of them would definitely need some case management where they can have somebody to call and that person can go over there and problem solve with them. Sometimes it was simple things and they just needed a helping hand. They weren't sure how to problem solve. A lot of my clients were aged out of the system. So they were, in foster care or group homes. So some of them lacked just basic knowledge on how to live everyday life, that most of us take for granted, but there's a chunk of people that can't do that every single day. So it was really hard for them to keep their housing as well. So there's those are some of the examples. I mean, the homeless population is just so complex. People are so different and their needs are different. So I think we really need to not group them all together because some need more extra help than others. I mean, that's just, the homeless population. So that's my take.
Yeah, well, I feel like that's also true of the population at large. Everyone has different needs and abilities. And when people don't have resources, the resources should come from somewhere. So I'm going to combine a couple audience questions here because people seem to feel in Davis that there's kind of two like groups of residents of people who are invested in homeless services and getting help to those people. And then there's people who might believe that, but are also worried about crime in general, or that someone said if we provide more services in Davis, then more homeless people will come to Davis seeking services. And that why is uncivil behavior tolerated if the individual is homelessness, but not tolerated for other people? So if you could speak to how you frame it in your mind, like the unhoused population in Davis, and how you can, I guess, like center them to understand how to address these residents of Davis who have concerns, but how we can still help the unhoused population in Davis.
Okay. That is a few kind of stickier questions combined into one. I appreciate the sentiments behind each of them. I guess I would say that without services that meet people's presenting needs, there's going to be no way for people to get better. There's going to be no way for whatever you might even find offensive or frightening or otherwise distasteful from improving. And in the absence of appropriate services that meet people's needs, I think that there's the question of, well, then, what next? And where it goes towards, where it points towards is kind of ugly, where I think that people would say, hey, let's just kind of kick that to the criminal justice system, and involuntarily deprive someone of their liberty because they're engaging in a way that's not acceptable to sort of social behavior as we deem should be. Incarceration is expensive. Courts are expensive. Policing your way out of a sort of health and social services problem is not going to yield you the kinds of solutions that you'd seek in terms of actually creating a safe and healthy community, especially for the people that are most vulnerable. And right now, I think there's the question of like, well, why are these behaviors tolerated if a person's living in homelessness when they wouldn't be tolerated if they were, housed? I think that's maybe a little ignorant. I think that maybe that the population of people living in homelessness, have experienced homelessness for a while, and that's given them, probably again the worst days and nights of their lives, and you're meeting them at a very low point, and also whatever issues that they have are probably more pronounced because of their state of homelessness, and they're also more visible because of their state of homelessness. So people associate homelessness with things like untreated psychiatric conditions or drug abuse, but there are plenty of people that are your neighbors, that are living inside that might have an untreated psychiatric condition or might have a drug problem. There's an opioid crisis nationally where most of the folks, kind of dying from that are living indoors. And I think recent history has shown that you can have people with things like malignant narcissism, sort of in the highest corridors of power and privilege, where if you saw that on the street, you'd say, why isn't that crazy person locked up for everybody's safety? And again, I think it's mostly a function of an unmet basic need and the extreme visibility there, rather than some kind of preferential treatment. And if you're living in homelessness, the odds are far greater that you're going to experience arrest or negative contact with the police than they are if you are living inside. And when that person is, arrested for something where they are engaged in criminal behavior, it might sort of feel like a relief to the person that sees someone placed under arrest and taken into custody. But then when you get to the jail, they're not going to be, held on to for any period of time, most likely because their offense is minor, So in terms of, the jail isn't jailing people for misdemeanors. People are given citations and given a court date and told to appear. And, they do experience contact with the criminal justice system, but it's not like they're getting off easy because they don't have housing. If anything, their contacts are more frequent. It's more difficult for them to make it to court. The outcomes, you might look at disparities in sentencing and things like that, where because they can't afford lawyers and other things like that, they probably have the worst of it. So I would push back at this idea that somehow services end up coddling people or create a magnet. All the research and local surveys, and you see this nationally duplicated, is that first, people tend to stay around systems of support, what little they have, when they start to experience homelessness. And it's expensive to travel, it's expensive to relocate. Sure, there is some element of movement where you're just looking for a safe place to be, but people tend to stay around home. So most of Yolo County's people living in homelessness are from Yolo County and have ties to the community. And if you care about your community and how things look and how you perceive your own safety, and you see someone living in squalid conditions where clearly their needs aren't being met and they're acting in a way that you find erratic or frightening, the solution to that is to give them the right kind of care that will help improve that for the person that is a member of your community. And it sort of creates a rising tide that lifts all boats.
I agree with you, Ryan. The cost of the homeless population on, as far as, with hospitalizations, in and out of jail, all of that is extremely costly. Emergency room visits, it's very expensive, so yes.
The Business Roundtable did a study in California on this that showed that the 10th decile of users of systemic resources living in homelessness, it was over $80,000 a year per person. And the cost of permanent supportive housing is far closer to 25. If we just took a kind of preventative approach that was housing first, that met people's needs and got them inside, then you wouldn't have to deal with all these expensive sort of reactions that often are kind of too late in terms of leading to the best outcomes for the person or the community.
Absolutely.
Yeah, and to add on to all the great points that Ryan and Rebecca made, I think it's important to keep in mind that there are a lot of different factors that contribute to homelessness. I think there's still a lot of misinformation and misunderstandings about what it means to lose housing. And sometimes that can be not only because of the things that people traditionally think about, for example, like drug problems or like not having enough income, but also like, for example, people who have to leave their homes because of like discrimination against like their sexuality or gender, or like survivors of domestic and intimate partner violence. Like those are all major reasons why people can't live in safe housing. And it's also important to keep in mind that when people don't have housing, like Ryan said, their behaviors that would typically be private are made public. So this is especially true if there are not sufficient resources made available to everyone, like public restrooms. But a lot of the things that people do when living outside, such as like sleeping, panhandling, or using the bathroom, and other survival behaviors like rummaging through the recycling, using public outlets, sleeping in their car. These are all things that people with housing can easily do in the safety of their own home without people having to judge them. But when you don't have housing, that's impossible, and everything you do is made available to the public eye. And lastly, as Ryan alluded to, when people are cited or criminalized or jailed for like performing their survival behaviors, it leads to a vicious cycle and makes it harder for people to reintegrate back into society, because after you go through the criminal justice system, there's like a lot of barriers that people have to encounter. Like, for example, you could lose eligibility for federally funded housing and other government support programs. And so I would really say that criminalization of homelessness is definitely not the answer. It's much better to have a prevention and also support for people before they enter the criminal justice system.
I think, I mean, Selena puts that really eloquently. She sums it up really well, building off of Ryan and Rebecca's points. This is a bit anecdotal and it might sound a little cliche, but I remember when I was doing outreach one time, I was in a conversation with one community member, and they said that one of the things they needed was a small connection to society. And I think, you know, that's kind of like the first step, bridging the gap that we kind of placed because we see these people as, as people who are not like us, when in reality we're all people with like basic fundamental needs, and just some of us have just been unlucky with the circumstances, and it's not like their fault. And I think it's so crucial to make that small connection by like making sure that these people's needs are valued and heard and made to feel valid, because I think that's something we get caught up in a lot, is just that perception that they are different. It's like that us versus them mentality that kind of takes hold, and like Selena says, triggers that vicious cycle that we could easily break out of if we just try to see things from a different worldview.
I think those are really great points. I think that homelessness is not houselessness. Homelessness implies also a lack of a sense of belonging, and that we're social creatures, that we need systems of support, healthy systems of support, non-toxic systems of support. There are people that end up living in homelessness, as Selena said, because home is not safe, and it's better to try to go it alone with everything stacked against people living in homelessness than to stay in a place that does not feel or is not actually safe for you. And when you find someone that's isolated and disconnected from their system of support because their system of support wasn't sort of healthy for them to begin with, you gain a lot of understanding into how homelessness is not a choice. There's a much higher prevalence of adverse childhood experiences amongst the population of people living in homelessness. There's generally a lot of trauma once you dig beneath the surface. And when we've asked people locally living in homelessness, do you want permanent housing? 92% of them have said yes. It's 1 out of 12 that have said no. And I question whether those 1 out of 12, many have kind of given up hope, or maybe they're not even really aware that there's something different that would be an option if the resource were available.
Thank you for all those very compassionate responses. I feel like it really helps to understand who the people are at the root of this and what their concerns are, what their needs are, and how we can help lift them out of these situations that they have ended up in. Because at the end of the day, we are all people and we all have basic worth as people. Going back to something that Ryan said earlier about meeting unhoused folks where they are, because services sometimes are hard to get to. Someone asked, what are your thoughts about having a mobile mental and social health program in Davis? And I know that Seanne had some things to say about that.
Yeah, I think the others could expand on this a little bit better, but yeah, I would say, I'm all for the provision of mental and social health help services. And Hope has, a small team of people who are dedicated to, gathering mental health resources and spreading that to not only the UC Davis student body, but other people within the community. And because, there's so much overlap potentially between mental health and like housing insecurity, it would be great to be able to apply that information to a larger scale and actually use that to take action. In the past, we've hosted events that, do cater to specific needs such as the mobility fair, that we use that in order to um, pay like to address the need for like transportation help and just like mobility resources in general. So at that event we provided Unitrans bus passes, and we also had students from a local school of podiatry to help them with like foot checks and addressing basic first aid and those parts of hygiene, because yeah, these needs, they're really important, but they may not be as obvious as like food insecurity, which is like another thing. So yeah, addressing things like mental health, which is already so stigmatized, and like I can't imagine it being even more stigmatized, for people who do not have a home. So yeah, like it's definitely something that I think all of us, especially Hope, would like want to look into in the future for sure.
Yeah, I kind of mentioned this in the chat, but I believe you're responding to Cheska's question about a mobile mental and social health program in Davis. I know previously this was discussed by the temporary joint subcommittee on public safety in the city of Davis, and a lot of people, including Hope, vocalized their support for the creation of kind of a mobile behavioral and social crisis program. I think that would be really beneficial because like the people who are most knowledgeable about how to handle these behavioral crises, for example, like Ryan and the people he works with, they aren't available 24/7. And like after hours, it might be like the police or other people who are less trained on how to handle these crises, who have to deal with these situations. So I think it would be a lot safer for everyone if there were a specialized crisis unit to handle these things.
That is helpful to, oh, Ryan, did you have something you wanted to add?
I don't have much to add, but I am supportive of the creation of such a unit. I think that it's a missing component in our system of first response. I think that you should have police responding to criminal stuff, and that you should have some form of social or health first response other than just 911, heart attack, paramedics, that kind of thing for when someone is having let's say a behavioral health emergency. The right resource for that probably is a behavioral health clinician. And beyond that, that 24-hour response would it would match the tempo of the need, in that you can have an emergency or even some non-emergency need for help that happens at 3 a.m, and that the sort of worst things that happen to people when it comes to health and social needs, they don't respect 9 to 5 work schedules.
I appreciate hearing all of your perspectives on this, because something that is going on in Davis, as many people know, is recommendations about public safety. And so some of the recommendations have talked about mobile crisis response being implemented in Davis, especially unarmed response, so that the people going out are mental health workers that can help treat housed or unhoused folks in Davis who are experiencing mental health crises. That seems like a really important thing to be addressing. So another question from the chat is, how can you guarantee that those affected by homelessness are represented in the city government and legislative process? How do you get those affected by the problems to the decision-making table and able to advocate for themselves?
I love this question. Just whoever asked it, I appreciate you. I think that when it comes to, so locally in the continuum of care, we're undergoing a reorganization where we're incorporating as a not-for-profit organization, and there's a seat reserved on the board of directors for a person with lived experience of homelessness in order to make sure that that perspective is provided as a group of providers and entities sort of working on the problem as a community. And in our grant proposal for a sanctioned campground, it includes like a resident council so that people can feel a sense of ownership over their circumstances and self-determine to the greatest sort of degree possible. I think when you're asking about legislative bodies, more like city councils or Congress or whatever, that kind of thing, that often it's more challenging in order to get those voices in the room. And that might be the job of advocates in order to bring them there for public comment or to do the legwork of collecting needs assessments that comes directly from people's mouths about what their needs are, and have that vocalized by messengers that are bringing like 50 or 100 people's voices there at a time. Beyond that, I don't think that there should be barriers to taking part in conversations that are public at all related to someone's housing status. You don't want to be talking about people to solve their problems, and that kind of just furthers the otherization. You want to be including people to talk with them about what their needs are, because people are the foremost experts on themselves.
Okay, great. So going back to the criminalization of homelessness, what constitutes criminal activity or creating a hazard while camping? Ryan, you did give the example of the drainage canal, but are there other perhaps less extreme examples that come up often? How are these situations dealt with? Do you respond, or do sworn officers? How is that handled?
Sure. Living in homelessness is a state of being and is not criminal by its nature. It's a failure, again, of kind of society at large to meet someone's fundamental needs because they're out of reach for that person to get for themselves what they need, which is a safe place to live. You see what people describe as the criminalization of homelessness often in things that are tangentially related to those unmet needs. And often it's not the sort of criminal, like penal code, kind of crimes, but it occurs in the context of things like code violations. So somebody might have an accumulated pile of property because they don't have a place to store their stuff, and it's all that they have left. And then it accumulates, and it might get wet in the rain, or otherwise it might attract vermin, rats or roaches or things like that, bed bugs. That where it creates a health and safety hazard, where you can point to some section of code and say that's not a safe way to be living, and if someone were to continue doing that, they would be in violation of some statute. Beyond that, maybe people engage in desperate behaviors sometimes when their circumstances are desperate. So there might be some criminality, again, that's tangential to homelessness, that they wouldn't be committing a crime if they didn't see another way out. But the classic example in Davis is you'd notice a camp with a bunch of stolen bicycle parts in various states of repair, things like that, where someone might have like a prior felony conviction that makes it hard for them to get a job, and they're caught in a vicious cycle in which then they have to turn to chopping bikes in order to have money for basic needs, or even to do something like to feed an addiction where they don't have easy access to treatment services that would help them to break out of it. But I think that the police department here, Davis PD in particular, does a good job of not criminalizing homelessness, and of generally pointing resources like me and members of my team, myself, Sandy Alvarez, Devin Young, to make contact with people and to assess and understand their situations and to try to get them resources, versus sending police officers to non-criminal complaints. But if you talk to people living outside, I think that is far from standard. And I mean, even locally, they might have a different experience with UC Davis PD or sheriffs or something like that, or cops in a neighboring jurisdiction or wherever else, that lead them to assume that that sort of we're going to view just their state of being as some kind of criminal violation, and then that prevents people from getting help. You know, if you're frightened that you're not going to be met by a helper, but that you're going to be met by someone that's looking for a reason to deprive you of your liberty or your property or something like that, that's a major barrier to getting assistance. And it can lead to some of the worst times where people are unserved for many years out of some fear that is in some ways legitimately grounded.
I think just having the team available, like Ryan's team, Ryan, Sandy, Devin. In Woodland, it would be Kristen Klein. And in Westack, it would be Mark Sawyer. I mean, that was just a huge step forward in itself, because a couple of years ago, that wasn't, you know, something that was available. So I think that little steps are being taken, for sure. So it's been something that's been so beneficial for the homeless population, just having these people available to them to help them, where they can go in and just have conversations with them. You know, they're not being arrested or anything like that. You have social workers that are having conversations with you. So I think that in itself is just a step in the right direction. So.
And speaking about reintegrating this population back into society, one person did ask, has providing apartments or hotels been successful at allowing some clients to attain employment and find their own housing? If so, how many people have had this success?
Yes, and the answer to the second part of the question is it really depends on the time scale that you look at it over. But that is one of the real fundamental kind of like and measurable desirable goals for really almost any provider of services for people living in homelessness is the journey ends once someone is stably housed. You know, once they don't require ongoing support, or in the case of permanent supportive housing, it's as long as they need it, maybe for the remainder of their life. But you look at outcomes from things like rapid rehousing or employment programs or connection with subsidies like housing vouchers that allow someone to, you know, afford a place to live, even if they have a limited fixed income from something like SSI. And that is the only way really that you get people into permanent housing and sort of out of a state of perpetual homelessness, is by giving them the opportunity to get access to those resources and a little bit of a hand up. It's not a handout. It's just something that maybe they can't access on their own. I think one of the challenges is that we are successfully permanently housing people through a variety of programs, but that the rate of growth of homelessness outstrips the rate of being able to house people. We don't have enough permanent housing placements. We don't have enough shelter beds. We don't have quick enough turnaround on construction of new affordable housing. And again, this goes back to, it is broadly sort of a socioeconomic, systemic, structural issue that is driving homelessness. It's not one person's individual set of challenges that you can point to and say, oh, that person, you know, is you know, living in homelessness because they drink too much alcohol and they can't control it. That's a way to point the finger at the person, when really you need to be asking, why is that person living in homelessness? It's because they can't afford a place to live, you know, and that's almost universally true. So if we really want to be able to get people, you know, out of homelessness, then we have to solve this problem of housing being out of reach.
And following up on that, are there services such as interviewing skills, like workshops held or pieces of paper handed out, or ways to help gain employment?
Yeah, we had a program called Pathways to Employment that Davis Community Meals and Housing had contracted with the city, and I think it ran out of funding. But there are similar programs like the Downtown Streets team, which is in West Sacramento, and I think maybe they're in Woodland right now too. I'll ask Rachel. That focus on the element of employment rehabilitation, providing people some case management and skills and recent work experience. There's also training programs like NCCT, Northern California Construction Training, that allows someone to gain a suite of skills that would let them get like a decent paying job in a skilled trade, not just like a MIC job where they're constantly be struggling with poverty. The Yolo County Health and Human Services Agency, the service centers have a good employment development division that does a lot of work primarily for families with kids, but also for single adults that might help provide them with the basics, like a place to live, so that they can work on something like getting a certified nursing assistant certificate, or something else that again will allow them to self-sustain going forward. And then Rebecca talked about just the need for sometimes what's described as life skills, like how do you cook for yourself? If you were living in the foster system getting bounced around, you may have never really had the opportunity to have a kitchen for yourself and to learn how to do that and grocery shop and manage your budget and everything that goes into it that some other people might take for granted. So I've definitely seen some longer term kind of like transitional housing or long-term emergency shelter programs that have incorporated again a personalized needs assessment, and then a kind of a psychosocial assessment that recognizes what supports and skills and strengths someone has, and where you can kind of shore up any gaps and deficits in order to help a person to self-sustain going out.
Yeah, you mentioned the rehabilitation center in Woodland. We have referred clients there, and they just kind of do a whole intake process with the client. They see what they can and can't do, what are their strengths, what do they need help with, and they try to find them some type of paid employment, which or like kind of an internship as well. I've had clients that have gone through that and then have gotten hired on. So, and I usually send people there that haven't had any type of employment for a while. They just got to get back on track again. So that's a good program. The client does have to continue to go. And again, it's really important for them to have somebody to come back to. So I had a couple of clients and they'd come back and we would problem solve. So, they'd be anxious about something or another. So I think our clients having someone to talk to is a huge thing, someone they can trust, that can help them problem solve instead of them giving up, which is, a thing.
That makes sense, that when individuals are outside of society, that you need the stability of society to come and help them reintegrate, and that it shouldn't be on the individual because society is a whole network and a person is just a person. We had a quick question that someone asked, how many homeless in Davis have received COVID vaccines?
I don't know the answer to that. I'll let Ryan, maybe, I don't know if Ryan has any numbers, but we are trying to do a pop-up clinic here at Respite so people can come in. We have clients that are interested here, so that people can come in and just get their vaccination here. Yeah. So that's in the works.
I wish I had a number for you, and if I can get that person's contact information, I'll get back to them. County Office of Emergency Services, Kristen Wyvoda's shop, has been working with a mobile vaccination clinic to go to sites like Project Rinke and DESP to get people vaccinated. I think the last that I heard was about 1/3, but I don't know if that's accurate. And I know that those vaccination clinics are kind of ongoing, but it's a good question, and I'd hope to see as many people as possible have access to that vaccine and have some education, about the vaccine if they're maybe reluctant about it, because housing is such a primary social determinant of health that if you get COVID when you're living outside, that the odds of a terrible outcome are far worse.
Okay, great. So that is our time today. Thank you to all of our panelists, Ryan, Rebecca, Seanne, and Selina, for joining us today and spending the last 90 minutes with us. For our attendees, you can find out more information on homeless services in Davis on the city's website. For the audience, thank you so much for coming out, and we will be posting the video in the next day or so on the Vanguard's website.
If you want to keep following the updates in homeless outreach services over time, we publish articles in the city news desk about homeless policies in Davis, and here are our social media accounts. We'll drop them in chat. The Davis Vanguard covers pressing local news and is able to do so through the support of the community. So if you would like to become a monthly subscriber and help us continue our important coverage, please click the link in the chat. Thanks again, and we'll turn it back over to David.
Thanks, everybody. I just want to mention that on the 22nd of February, also at noon, I think that's a Monday, we will have the Public Defender's Office talking about some of their work. And then on the 5th of March, we will be discussing ethnic studies, which is another big issue in our community. So thank you for joining us, and hopefully we will see you next time.